1 billion people worldwide currently live with a mental health condition. Close to 700 million of those individuals suffer from anxiety and depression, and every year, 700,000 take their own lives. Despite this scale, the financial response is minimal. Governments allocate a median of only 2% of total health budgets to mental health. This severe underfunding creates a systemic failure, where the financial resources provided bear no relation to the actual size of the crisis. Global research funding is also in retreat. After a period of growth, total investment fell back to 2014 levels in real terms by the year 2023. This shrinking pool of capital is highly concentrated, with 80% of all global research funding currently localized in the United States. This creates a translation gap. Even when research is funded, the resulting scientific discoveries often remain trapped in academic circles. This means that critical data points and potential treatments are failing to reach the clinicians and patients who could actually benefit from them. Without a functional bridge between the laboratory and the community, the science remains invisible and its potential for impact is lost. To address this disconnect, Wellcome and the journal Nature have launched the Wellcome Prize for Mental Health Science. The initiative uses a high-stakes financial incentive, a $1 million grand prize, and 3 $250,000 awards. To qualify, submissions must be evidence-based and at an early stage of research. They must also demonstrate the potential for wider adoption, scaling effectively beyond a single lab. This prize functions as a mechanical pull, designed to transition promising research out of isolation and into direct public application. These modern interventions look very different from the clinical stereotypes of the past. The scope includes high-tech solutions like non-invasive brain stimulation and digital therapeutics, software designed to treat conditions through real-time behavioral monitoring. It also encompasses systemic changes, including psychedelic-assisted psychotherapy, school-based mental health programs, and community policy reforms. An international panel of academics, industry leaders, and policy experts will judge the submissions based on their measurable impact. Crucially, the panel includes judges with lived experience of mental illness, ensuring that the research results in support that is both sensitive and effective. These diverse approaches have evolved the definition of a cure into a multidisciplinary ecosystem of physical, digital, and social solutions. The historical lack of visibility for these interventions is rooted in a dark legacy of medical care. For much of modern history, mental health interventions were defined by social control and isolation rather than therapeutic intent. Patients were often viewed as dangerous or deficient, leading to institutionalized practices that prioritized containment over actual recovery. Today's funding disparities are the direct result of this long-standing urge to keep mental illness invisible and outside the bounds of traditional medicine. Solving a billion-person crisis requires sustained systemic investment from global governments. This prize acts as a narrative catalyst, using a high-profile award to force global visibility onto research that might otherwise remain fragmented. It provides healthcare policymakers with the evidence needed to justify larger budgets and more effective service models. By requiring peer-reviewed rigor and measurable improvements in outcomes, the initiative establishes mental health research as a field of serious scientific discovery with a concrete impact on human life.